It is phenomenally common for people when their child is being diagnosed or assessed for autism or ADHD that they start to think actually that they could be autistic themselves. Because as we know, autism has a genetic variant to it. It can be very mild. It doesn't always come through in all families. It's quite a complex relationship of genetics, but it is there somewhere. So it's really, really common for parents to actually be autistic themselves, but never having got a diagnosis. And then when they see their child going through it, they hear the questions being asked, they think about the things that they're looking out for, they have those ping moments and think, hang on, that's what I experience as well. So the things that we ask about and the things we look at are, we first of all often look at the childhood and things like types of play, making friends, how easy it was to make friends, relationships, sensory differences, experience through school. So that's the first thing we ask about. And that's quite often when a parent might start to think, hang on, I found school really hard, or yeah, I had those friendship difficulties, or I didn't like to play. I found it hard to play in the groups, or I got very overwhelmed at parties or birthday parties, just things like that. And then when we kind of go on into adolescence and adulthood, we'll again be looking at more complexities around relationships. So the ongoing issues around social situations for a lot of particularly girls and women and non-binary individuals I've worked with, there's been quite a lot of difficult relationships they've had as they grow up. I have a lot of women whose children are being diagnosed who have gone through a lot of vulnerability in their life. And when they hear that that's something that happens to a lot of neurodivergent girls and women, it kind of speaks to them and they think maybe that happened to me because there was a kind of pre-existing vulnerability in me. So if you've had those light bulb moments or ping moments during your child's assessment, and this is something I've experienced when I've been with families, is quite often it's good to wait till the end of the assessment because, as the person on the other side doing the assessment, I want to give my 110% to your child as I'm doing the assessment. And then if I'm going to give you my attention afterwards, I want to make sure I can move my attention to you. So I would always suggest is maybe start making some notes yourself during the assessment process. Think, oh, that's what flagged up to me. That speaks to me. And then when we come to the end of your child's assessment, just come to the whoever it is, whether it's me or somebody else, and say, okay, now we've done that, I think maybe I'd like to talk about being assessed. So if you've had the courage to think, okay, I want to get assessed, which is a big moment as well, especially if you're older, obviously you've gone through into adult life, then approach maybe the person that has assessed your child if they can just help you, give you some advice. But the first thing I would say to anybody is, start making your own notes, actually. It sounds weird, but start kind of gathering your own evidence because particularly when you're an adult and you want to start the process, it's really helpful to actually go into that journey with some information behind you. So actually use the background and the reference of what your child's assessment has covered and start to think, okay, maybe go and ask your own parents or your siblings, do you remember how I played when I was a child? Do you remember this when I was growing up? Did I make friends? What did you see? Just because that's what will come up in your own assessment. And the more you can go in with your evidence and your information, the easier that process will be. So in summary, it is very, very common for parents to think that they might be autistic after going through the assessment process with their child. It happens a lot, so just know that. If you get to a point at the end of your child's assessment where you think, okay, I want to go for this and I want to go for an assessment, be aware it might bring up some really big emotions for you, for the family, for your partner. So just sit with that for a minute and give that space before you make those decisions and make sure you feel safe doing that. So if you think an assessment is the right choice for you, then the best thing is go to the person that assessed your child and they will signpost you in the right direction.